Not how it works. Remember, this is for you to have an idea, for you to educate your patients just in case it's needed. Because some patients just think the way that we think. If they don't have any knowledge about microorganisms, the difference between these microorganisms and the difference between, certain medications that are used depending on what microorganisms you have acquired. So that's basically what we need to understand. Deadly infections factors, international travel and food shipment. So now you said, oh, what do you mean deadly infection factors, international travel? No, how these microorganisms come from different regions, different countries, different locations, and reach us. Remember, most of these are coming from other countries. So that's basically what it is. People go to a different country. See, whenever I come to my country, because it's a tropical country, I have to get certain vaccines because I'm going to be exposed to malaria, chikungunya, hay fever, because it's very prevalent. And the water is not treated as is treated in the US. So I might be treated also for salmonella, stomach viruses, or C. difficile. We're going to talk about those. So these stomach viruses are very common when you move, outside of the country because all these unprepared food or over prepared or food that is already spoiled or processed with, you know, water that's not treated because certain countries they don't treat the water the same way that we treat it in the US. So we develop certain conditions. So that is basically what it is. We have food that is transported from different parts of the world, far away. I'm not being against any country, so I'm not going to mention countries, but we import foods from different countries. We export foods to other countries as well. Well, during that processing, during that shipment, during that time that this food is traveling to different far distances, it gets contaminated due to the handling. Temperature, for instance, certain food needs to be refrigerated. But some of the time, this food is not well refrigerated. So the food goes bad. Now, whoever consumes this food, even though it has not expired yet, you're going to get sick. Or it is contaminated because it is mixed with the other products that are being also shipped somewhere else. As our population grows, more people develop certain more conditions. See, every single time we have a different condition that is being added to the formulary. If you're not a medical doctor, you're not a nurse, you're not gonna know this. But every year, that's what we have to have a different, an updated directory or a PDF, the physician dex reference, or the national formulary. We need to have updates, add-ons, medications that are removed, medications that are added, conditions that are, you know, were eliminated, eradicated, some other conditions that are prevalent. So that's basically what it is. Remember, we didn't have the COVID-19 a couple of years ago. Well, more than a couple of years ago. Now we have it. Now we have different viruses already going on. Those are added. And there are medications that are being manufactured for those conditions. So we got to be familiar what's going on. For public health infrastructure, that means that we don't have a good health system. So again, our administration, unfortunately, is very, very poor when it comes to health. services. It was good, or it was good, and it said it was excellent, but now it is really bad. Why? Because instead of improving those services are being removed. Immunosuppression. Now, immunosuppression means a lot. Your immune system is compromised due to the abuse of so many medications. Bad habits. Remember, medications that used to work for this condition no longer work in the same patient. Why? Because it was abuse. Patient took it too much. The medical doctor probably provided too often. We need to be kind of alternating certain medications because the body comes to the time that get used to that medication. And in order to work a little better, you need to increase. And increasing does not means better. That means that your system is not responding to it. So we have to start other approaches. So that's basically what it is. We super abuse medications as patients, as medical providers. Medical providers needs to please the patient. Medical providers needs to look good in front of the patient. So if you do not offer a medication to the patient is going to say that the medical doctor is not a good doctor. Being there, being told that you're not a good doctor. I'm sick and you're not giving me anything. I need medications. Sometimes certain medications are not recommended. So that's basically what it is. There are certain conditions that we ask the patient to rest, drink lots of fluids, follow a blunt diet, stop smoking, drinking, start doing exercise. People don't listen to it. They just want medication. They just want chemicals. And if we do not prescribe to them, guess what? They auto-medicate themselves. Because that's what we do. That's how humans' brain works. We already mentioned resistance to antibiotics, meaning those antibiotics that no longer work because you abuse them. That's immunosuppression due to the excess of medications or other conditions. So that's basically what. Remember, sometimes we don't have just one condition. Some people have one, two, three different conditions. And for each one of them, they're taking different medications. Some of these medications might interact with other medications that the patient is taking, lowering or increasing its effect, which is not good. As we age, also, remember, age is a huge factor with medication. Remember, this is pharmacology. So a medication that works for patient A that has diabetes does not work for patient B that also has diabetes. Why? Because everybody's body is different. The condition might be done to this, to that, and other factors. So we definitely need to be very careful because otherwise we're going to create some type of resistance to antibiotics, meaning these antibiotics do not work for that particular condition that you may have. Here is a condition that definitely very common. It is very common. It is currently going on. It's been going on for a long time. This is called methicillin-resistant Staph aureus infection, which is called MRSA. This is the acronym for this particular condition. So this is a bacteria is resistant. It says right here, the bacteria is resistant to antibiotics. But which antibiotics are we talking about? See, it says methicillin. This is the family of the penicillins. And penicillins are the most common antibiotics out there. the oldest, the most common antibiotics to treat most of the bacterial infections. They really work, but it's been so abused that it comes to the time that the body does not respond to these antibiotics anymore. So we have to use other type of other options. So that's basically what it is. Remember, this affects mostly people who has the immune system immunocompromised or is weak, patients who are admitted, patients who are in the ICU, nursing homes. These are the places where these patients are going to get this condition because they are continuously being infused or administer these medications. So the body comes to the time that it doesn't respond more to it. So that is called MRSA. Remember, Staphylococcus aureus, this is one of these um, gram-positive bacteria. This is the good bacteria. Staphylococcus, the normal flora. This is the one that protects us. But the problem with MRSA is that if invades a different place where it's not supposed to be the habitat that is supposed to be surviving in, then immediately they cause infection. Let me give you an example. All of us have staphylococcus everywhere in our body, everywhere in the surface of our body. But if you have a little cut, this bacteria, if it's not treated immediately, the cut, the injury, the trauma, it's not clean, it's not use antiseptics and do whatever procedure needs to be done to protect that area. These staphylococcus is going to go inside there and it's going to irritate the skin. It's going to kill the cells. So that's when you develop these pus coming out. It's going to be swelling, redness, a little hot to touch. You can develop fever. You have an infection. You have pain in that area. And this is a good stuff. But the problem is that if it goes where they do not belong, they're going to cause an infection. So that is methicillin resistant stuff. You're not going to be asked about this, but again, these are, mostly um, bacteria that are resistant to antibiotics. In this case, these are penicillins. Clostridium difficile. We call it C. diff. Why? Because this is too long. Clostridium difficile, that's too much. C. diff. So this is another bacteria that causes problems in the digestive system. And how do we know? Because we develop abdominal pain, nausea, vomiting, or diarrhea. Unfortunately, once again, these microorganisms, these bacterial infections happens mostly to patients that have the immune system compromised. People who is admitted in the hospital. So that is basically what it is. So these patients did not have this condition. They developed the condition after they been admitted. So that is basically what it is. Because remember, certain conditions happen because we give them too much antibiotics to the patient, and these antibiotics destroy the normal flora, which is the one that protects you. So antibiotics are not good all the time. Yeah, I have some bacterial infection. The medical doctor gave me certain amount of pills, tablets, that are needed, that are necessary to cure that condition. But if you take more than, or you don't take the medication as prescribed, these medications are not going to work. And you're going to keep on using and abusing the medication because you're going to keep this condition stopping and returning, like intermittent. It's not like the medication did the work. No, the medication was working. Then you stop. Then you didn't take the medication on time. Oh, I forgot. So then the medication don't continue to work. So the microorganisms, the one that survive, multiplies again, and you develop the symptoms again. Now you keep on taking the medications that were prescribed, thinking that that's going to help you. But what you're going to get is you're going to develop resistance to it. Not good. Once again, all these conditions occurs when the patient is hospitalized because the patient is receiving all these treatments continuously, antibiotics. So most of the time, what they do, remember, we're talking about the digestive system. So they attack the intestinal tract, the inner layer. So that's basically what it is. No worries about how this condition is treated, but yet, we do have certain medication that works for it very well. But that's not the problem. The problem is how you acquire the condition, who develops the condition, and why these conditions attacks mostly patients that are hospitalized. Remember, immunocompromised. The immune system is very weak. So for that reason, these microorganisms conquer your body very easily. That is how it works. Any questions about these conditions that you might develop when you are hospitalized due to your immune system being compromised? I'm going to tell you which questions are going to be on your test, but C. diff, pay attention to it because one of the students mentioned once, what is it? So what is C. diff? Remember, this is Clostridium difficile. This is a bacteria. This is a bacteria. So always think about that. It just is a bacteria because if it is a bacteria, it's going to be treated with antibiotics. They're not going to ask you which antibiotic you're going to know. If it is bacteria, we're going to use antibiotics. If it is viral, we're going to use antiviral medication. If it is a fungal infection, we're going to use antifungal medications. If you have parasites, anti-parasitic medications. Forget about flagyl, vancomycin, or any other type of medications used to treat bacterial infection, because you will not be asked about these medications. They're going to ask you about the classification, which is, oh, an antibiotic. That's it, an antibiotic. This, you have to pay attention to it. E. coli. E stands for Escherichia coli. This is another bacterial microorganism that is going to cause you abdominal pain, diarrhea, and sometimes you can have bloody diarrhea. It's a very, very bothersome. This happens when you eat contaminated food. People people do not wash their hands when they're preparing your food, particularly salad, fruits, things that are not cooked or things that are not well cooked or undercooked. So any of those can cause you, that's like stomach virus. So whenever we travel overseas, particularly me, I don't eat certain things in certain places. It doesn't matter how fancy it is, the place. There are certain things that I don't eat because I know they are not going to follow the proper hygiene to prepare certain things, particularly salads, because I'm definitely going to get stomach virus. So that is basically what it is. Now, this E. coli usually affects the intestines. So that's basically what it is. So it causes you inflammation of the intestines, particularly the large intestine. They give you abdominal pain, but this is not just abdominal pain. They give you this crampy pain. And Definitely, when you get that, you're gonna be having diarrhea. Not countable, painful. So again, you have to be careful when you go eat out, particularly those places that they sell these, most of these food trucks, um, they don't keep these levels of hygiene that we want. I'm not saying that all of them, but if you look at them, if you have ever purchased anything from them, these people have the same pair of gloves. Check them out. I do. I don't buy shit, or I don't buy food from them. My apology. Because they have a pair of gloves since the moment that they open business, and with this glove hand, they prepare your food, they take your money, they give you the change, they go to pee. I don't know what else they do with this glove hand. So I don't trust them. So I don't eat on those places because I might get these E. coli. So questions for exam. Which is the most common bacteria that causes diarrhea, abdominal pain, or food poisoning? E. coli. That's it. Simple. Don't look for anything else. It's E. coli. But most of the time, what they ask is what we're going to see later on. Escherichia E. coli. It causes urinary tract infection in females. It's the most common offender. But whenever you think about and hear about stomach virus, abdominal pain, diarrhea because you ate something that was not properly cooked or clean, think about E. coli. Period. That's how it works. Water that is untreated. Here in my country, I don't drink juices from a restaurant or lemonade or any of those things because it's very famous around here that you go eat and they give you a jar of lemonade. Why? Because they use tap water and tap water is not treated well. So as soon as I drink it, I'm going to the bathroom, not to pee. I develop diarrhea. So I got myself bottled water. Said, oh no, give me a bottle of water. If I ask about juice, they're gonna mix it with water that is tap water. So it doesn't matter. I don't take it because I know how it is. It happens to me once, so I said it won't happen to us. So this is common when you travel, particularly, and that's what sometimes they call it traveler's diarrhea, because it happens when you travel and you eat all these undercooked, untreated, whatever you want to call. So that's basically, oh, here it is. Escherichia E. coli. Remember, this is called E. coli, so they're not gonna give you all these names. Think about E. coli, E. coli, E. coli, period. Everything that you can imagine, food, whether it's lettuce, whether it's fruits, whether it's meat, beef, whatever the case might be, if it is not uh, kept refrigerated to certain temperatures for certain periods of time, these microorganism, this bacteria, is going to grow in this particular foods, and you are going to get sick. Believe me. So read what it says right here on the bottom. This is question for the exam. The most common offender, the most common bacteria that causes urinary tract infection. Now, we're not discriminating, okay? Why in women? Because anatomical structures, the urethra is very short, and the urethra and the anal canal are very close. So when the person cleans up after moving their bowels, if they don't clean correctly, they're gonna bring feces from the anal canal to the vaginal area back and forth. And that is where E. coli is at, because it is in your feces. Remember, E. coli lives in your digestive tract, particularly the large intestine. So when you poo, you defecate, E. coli is going to be dragged alongside with the stools. And when you clean up yourself, you don't clean correctly from to the back, once, not back to the front, then you're going to contaminate yourself and you're going to develop urinary tract infection. That's it. So what are the symptoms of urinary tract infection? Burning sensation when you pee, itching, you pee a little bit and then you stop and you feel you want to go pee again, but the burning sensation and urination is um, the most common symptom that you might develop. So think about that, because this is a question for national exam. We're gonna talk about this again during phlebotomy, but see, we keep on repeating most of the things because that's the only way that you can recall this. It's important that we mention. Any questions about E. coli particularly? Because this is a question for exam. I will give you this question so you will have it there when you get it in your national exam. Remember, E. coli, you don't have to spell it out. You just need to know that E. coli is a bacterial infection. We're talking about bacteria, remember. Everything Clostridium is a bacteria. Whatever produces syphilis is a bacteria, which is the Treponema pallidum, and any other conditions. So we are moving on. Salmonellosis. You heard about salmonella. That's very similar. See, these are bacteria. So what they do, they are very similar to C. difficile. It is very similar to E. coli because they affect your digestive system. So sometimes you don't know which one is it. But the reason that you know that this is one, because you don't develop UTI with E. coli because you were hospitalized. Most of the others is because you've been hospitalized and you've been given all this medication. Remember, antibiotics, when you give too much antibiotics, they destroy the bacteria that protects you. So you're eliminating the offenders, but at the same token, you are eliminating good bacteria. So you're going to be exposed to opportunistic infections. And that's what happens in hospitals. It's not intentional. It's just that, sometimes I have to treat you with certain antibiotics, but then I'm going to weaken your immune system. More antibiotics, more good stuff that I'm going to eliminate as long as the bad stuff. That's why we have to select the appropriate antibiotic. That's why people should not be auto-medicating themselves. Because instead of getting better, you're going to get worse. So that's basically what it is. So once again, you're going to develop diarrhea, abdominal pain, all those things. For how long that varies depends of each patient is different. Depends on how weak their immune system is. But it goes in between 4 to 10 days. That's a lot of time for you to be having diarrhea, abdominal pain. So again, you heard about salmonella. So be careful with the patients that are, hospitalized or under all these medications, particularly antibiotics. See, all these conditions that affects the digestive system, if affect the digestive system, think about is what they eat, how well prepared these foods were, how well preserved these foods were before you ingested them. So some people eat stuff that is raw. I don't like sushi, by the way. I don't eat certain things because I just not used to. And I don't like it. As soon as I see them, they are raw. No. Well done. Oh no, if I have my steak, it has to be well done. Fish, seafood, has to be well done. So again, it says right here, infected food handlers, whoever is preparing the food. If they don't follow these not standard precautions, but yes, washing their hands first and wearing some gloves when you're preparing food and removing those gloves and not touching anything else when you're touching or handling foods because then you're going to contaminate them. So that's basically what it is. So that's salmonella. Why is salmonellosis more common in summer than in winter? Remember, think about this. Microorganisms survive more, multiply more, spread more during summertime because they like humidity, they like high temperatures. Think about when you go to the doctor's office or the hospital. How's the temperature inside? I heard you. Below environmental levels. Why? Because we keep the temperature below what is considered normal because meaning a little cooler because we want to prevent the spread of these microorganisms. If the place is kind of cold, that's why we have refrigerators. Leave a piece of meat outside refrigerator on top of the counter in a container and place another piece of meat inside the refrigerator. Which one is going to spoil faster? The one outside because of the temperature. So that is the reason why, salmonellosis, it is more prevalent during summertime. Wintertime kind of slows down certain conditions because the microorganisms do not move fast in a cold temperature. They do not reproduce, they do not multiply as fast as they do during summertime. What can be done to prevent infection with E. coli or salmonella? Well, to prevent it, if you're preparing this food, it's a different issue. But unfortunately, sometimes you get this food from someone else. So you need to understand what's going on. Don't eat things that are raw, particularly untreated, undercooked. That's the only way. And to prevent UTI, learn how to wipe yourself after you do number 2. Because if you don't do it correctly, front to the back, once, remove the paper, once again, another piece of toilet paper, clean again, and another one, and only one way, front to the back, front to the back. That is it. Then you're going to prevent yourself getting UTI. Remember, UTI is a very, very common infection, bacterial infection in females. Remember the symptoms. Burning sensation during urination is the most common one. itching on the vaginal area. But the burning sensation when you pee is the gold standard symptom. As soon as the patient said burning sensation, we know already. We know already what it is. We know already how to treat it. Because these are things that, happen so often. And when they happen so often, we are very familiar with. Okay, so do not forget about E. coli. Because that will be once again, but mostly they're going to ask you, what is the most common bacterial infection that is caused by causes urinary tract infection? Then you're going to say E. coli. Don't forget about that. Streptococcus. Remember, Streptococcus is bacteria, but this is a normal flora bacteria. But just because it's a normal flora, do not think that it's not going to cause an infection. Remember, if this bacteria moves from the side when they survive and doesn't cause no harm to our body, if they go beyond that area, then they're going to cause infection. We have two groups of streptococcus. Remember this, my bad. This is a streptococcus, not staph. This is the bad bacteria. We're not supposed to have, we should not have not even one strep bacteria in our body. These are the bad elements. So usually we don't have them. So if we develop them, we're going to be sick. So there are two groups. Streptococcus is considered in two groups, Group B, Group A. How do we know that? Well, if you start complaining about sore throat, some skin itching, burning, so then we know that you have Group A. Group B is more serious. So usually it is within the blood flow or within the cerebrospinal fluid. So the liquid that goes through the spinal cord to the brain. That's why if you develop streptococcus within the cerebrospinal fluid, you might develop something that's called meningitis. So meningitis, which is bacterial, it is more serious than meningitis that is produced by a virus. This one kills. Not long ago, but well, I don't recall, but it was like maybe 5 to 10 years ago. There was an outbreak of meningitis in Brooklyn. I don't know if you heard about that. Mostly it happens to the Jewish community. Well, lots of kids that die from meningitis. And one of the reasons is because the Jew people do not believe in vaccinations. So they did not vaccine their children. So they pay the consequences. If this group B goes to the blood, now you're going to have septicemia. It is very, very serious. A person can die within 24 hours of acquiring this group B with streptococcus. Remember, that's what we call it, strep throat, because you have an infection within the throat. But that's not the most serious. It's group B that is the serious one that can kill you. Strep throat is not going to kill you. It's just going to bother you. You treat it with certain medications, and that will be it. Now, things that you need to understand here is streptococcus is a bad bacteria. It doesn't matter where is it. It's bad. We don't have it inside our body. We have none. And if you have one, you're sick. Staphylococcus, on the other hand, this is a normal flora. We have millions of them in our body. They protect our body about, against intruders, against stress. But if they goes on the wrong side of our body, then they're gonna cause an infection. So that's basically what it is. So the group A Streptococcus, which is called gas, produces something that is called flesh-eating bacteria. You heard about the flesh-eating bacteria. That's called Necrotrizin fasciitis. So this is a bacteria that destroy muscles, fat, skin. So your skin start falling off because start eating it. These bacteria start eating your, leaving the bones only. That's not good, right? Very serious. So basically, you need to have, a port of entry through your skin. And sometimes these streptococcus you might find in places like certain rivers, lakes, ponds, even the sea. So we don't know where they are, but if they happen to enter your body, this is what's going to happen. Very bad. There is another one, which is part of the group A, another fatal condition that can happen to you. This is called a streptococcal toxic shock syndrome. Now, again, we're talking about these bacteria. This changes, this increases your blood pressure and damages your organs, like kidney failure. It says right there, more than 50% of the patients die. With necrotizing fasciitis, if it is detected on time, we have chances of survival 80%. You will not be asked about this, so just for you to know that there are some bacteria that are so bad, and sometimes we hear or we watch documentaries or news in YouTube, I don't know, whatever other media, and we hear about these flesh-eating bacteria. Because seriously, it happens. So that's basically how it works. How are we going to minimize the exposure to these microorganisms? But there are things that we can control, other things that we cannot control. So here we're going to show things that are controllable. Healthy diet. We can control what we eat. Definitely. So a healthy diet, remember, preventing ourselves from eating, these undercooked or spoiled foods, or eating from places that you might, suspect that they do not follow the proper hygiene protocols. Smoking. Smoking, it is bad because nicotine, what it does is damage the respiratory tract, the digestive tract, the urinary tract, the reproductive tract. So if they damage all these lining of these structures where we have these microorganisms that protect us, so we are given the opportunity of certain microorganisms to enter our body and damage it. Stress. Stress causes your immune system to go down. When you get stressed out and you don't control your stress, believe me, if there is something you cannot control, then let it go. It is easier to say it, than actually accomplish this, but that's how it is. When you stress yourself out, haven't you noticed sometimes that you have a medical condition. It can be something simple. And you stress yourself about that little condition, and then something else hits you, and something else hits you, says, oh my God, I never have this condition, and now they have one now, and instead of having one condition, now I have two or three, because you are so stressed out that you kind of, lower your defenses. So that's basically what it is. So mentally, psychologically, we can cause some damage to our immune system. Exercise. Now, once again, if you exercise, keep a healthy diet, don't smoke, hey, your body is going to be in good shape. So you are going to prevent, you're going to kind of minimize the risk of being affected by these microorganisms. Sleeping well, adequate sleep. You can imagine how important it is to sleep. It's not just going to bed and tossing and turning in your bed and being stressed out about this or that, not being able to console sleep, because that you're stressed out and you're now not being able to sleep. So stress, not being able to sleep, which is called insomnia, that's another factor that depresses, lowers your immune system. So you have to sleep. The minimum hours that you should sleep is between seven, 6 to 7 hours, at least. Not waking up 3, 4 times at night. No, you go straight up 6 to 7 hours on an adult. Little kids are different. They sleep 100 hours per day. Maintaining your immunizations. Remember, immunizations are prophylactic medications. Prophylactic means you are taking these medications to prevent something from happening. But if you don't take these preventive medications, now you're going to be at risk of developing the condition and probably at the risk of dying from the condition. So immunizations should not put them aside, should not ignore your immunizations, particularly for the little kids, because you need to, increase their level of defenses by giving them immunizations. And as we grow older, whatever immunizations are out there to prevent us from getting sick from certain common conditions that happens during our lifetime, then we need to keep our immunizations. Immunizations are good. I have all my immunizations, whatever immunizations I need, I always get it. I don't believe people tells me this is not good, this causes this. People that get this vaccine, they die the next day. They didn't die about medication, they die about something else. So don't listen to things, because then you're not going to be protecting yourself. From day one, at the moment of birth, children gets vaccinated. So that's basically what it is. And they are protected. It's not that you're not going to develop the condition. Remember, vaccination is not to prevent 100% that you're not going to develop the condition. No, if you develop the condition, it's going to be very mild. Your child is not going to end up in the emergency, intubated, probably dying. No, you're going to get some symptoms, but it's not going to be as bad as if you weren't vaccinated. So you get your immunizations, up to date. Very important. Adequate fluid intake. Now, once again, we talk about fluid intoxication. So you just need, that's what it says, adequate. Depends of your level of activity, gender, weight. Because if I don't do much, I don't do exercises because I'm sitting right here teaching all the time. If that were the case, but I'm gonna be drinking so much fluids. It makes no sense. But if my levels of the activity are different, I work in construction, I run, I'm a sports person, I do this, that, I use my muscles. Well, my muscles uses more fluid, so I need to replenish those liquids. So fluid intake, definitely. You have to talk to your doctor to see what is, the adequate amount of fluids they should be taking, or talking to your dietitian. Positive attitude. Remember, it sounds like, people might think, oh, seriously, I have a positive attitude, but I get sick. Probably you don't. Because remember, positive attitude is not getting stressed out for simple things. Sometimes we fight for everything. Somebody caught us when we're driving. Oh, we immediately develop this road rage. Immediately start cursing and doing this, and whatever happens, my colleague got a raise of 10 cents and you're screaming your lungs out, why they were not giving to me. All these things that you do, you are, affecting your immune system. So you're getting angry, you're getting a bad attitude, blah, 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 and probably you're going to get fired. Not to mention that. So you have to have positive attitude. That will maintain you calm. Good hygiene, of course. You need to take showers. You need to keep, your hygiene as a female, as a male, private parts, things like this. So it's not just to look good, not to smell good, but to eliminate some of the potential microorganisms that might be entering our body if they are in the surface. We need to remove them. They don't belong there. So good hygiene is very important. You wash your teeth, you take showers, you wear, deodorant, many other things, because that is what keep you clean. And when it's clean, microorganisms kind of refuse to invade your body. Think about this. If you leave all these leftovers in your kitchen, what are you going to see there later on? Cockroaches, mosquitoes, ants, I don't know, and smells. Well, this is a focus for, microorganisms. Same as our body. If you don't take a shower, if you don't clean yourself, if you don't wear clean clothes, well, guess what? You're going to be prone to develop conditions because you're going to have the perfect habitat for these microorganisms that wants this environment. Don't share food or drinks with others. Remember, microorganisms are transmitted through saliva. If I have this glass right here, I'm drinking something, whatever it is, or eating something, and it turns out that I just shared with someone else my glass, my bottle, whatever the case may be, within the saliva, it's going to be leaving the microorganisms right there. So when I put this bottle, this cup, this spoon, whatever the case may be, in my mouth, these microorganisms are going to go to my mouth. Believe me. So this is not that you're going to be sharing something with someone, with an strange. You don't do that. It happens with friends, family members, because we always kind of, oh, hey, honey, hey, baby, take this, huh? And trying to, fit spoon them, or just giving something from your bottle. No, get your own. Or if you're not going to drink anymore, well, then the other person is going to have your saliva. I'm not taking this back. Use a disposable cup or something else disposable, fork, spoon, knife, whatever the case may be. Just split things before somebody touch them. Keep hands away from face. Remember, our hands are the port of, the mode of transmission for direct contact, transferring medication. Remember, our hands are touching everything. We don't see the microorganisms in our hands. Even though if I live in my bedroom here, only the people who cleans my home come here, but they are cleaning. They're not touching anything. They wear gloves. But my phone, I'm pushing it right here. Somebody says, "Oh, listen, somebody's calling you. Somebody's this." Oh, I take the phone. Right there, I'm touching somebody else's stuff. Phones. So keep your hands away from any of the mucosal areas of our body. Eyes, ears, nose, mouth, because everything that we have, you kind of use your hands to bring stuff inside. So that's what we are going to prevent. And we can do it because if you follow certain protocols, be careful, particularly in your workplace. Okay, so if you develop any of the symptoms, you have to seek for medical attention immediately. Fever. If it is high fever, immediately you have to go to the doctor. So there are certain symptoms that, occurs to you, but they might be temporary, like chills. Oh, I have a little fever, a little chills. Should I go to the medical doctor immediately? Well, I don't think so. But if it is a high fever, but you have to check the temperature. You have to use a thermometer. You can just place your hand right there and say, "Oh, I'm hot." It doesn't work the way. You have to check the temperature, that the temperature goes over 100.1. Then you have high temperature. Over 100.4, you definitely need to go to the emergency. Remember, we covered already vital signs, which is considered, a serious body temperature. Because we learn about what is normal. Now, if you develop confusion, that is definitely a reason to go to the medical doctor. An infection that, you have the infection, then your son, your daughter, your mom, someone else get it. Oh, wait a minute. Gotta go to the doctor because I'm spreading this infection. We need to be taken care of. So anything that started worsening after the onset of the condition needs to be addressed by a medical doctor. So anything that you see in your body, any changes, you see lumps, bumps, skin discoloration, swelling, pain, you definitely need to go to the doctor. Because the sooner, the better. So that is how you address these things. Now you develop nausea. Well, I'm nauseous. I'm gonna run to the medical doctor. No, you have to wait until see if for how long this is gonna go. And if you develop vomit, you start vomiting. Now, how many times you vomit? If you just have one or two episodes, probably it's gonna stop right there. I'm not gonna run to the medical doctor. But if you're vomiting 3, 4, 6, 7 episodes, now you're getting dehydrated. Now it is a concern. Or diarrhea. See, we have a misconception about diarrhea. You think that diarrhea is just loose stools. Oh, I went to the bathroom and oh my God, I have this abdominal pain. Go to the bathroom and get it out. Watery stool. But I have only one episode or two. That's not called diarrhea. That's called loose stools. That's it. Why do I call diarrhea? If you have more than 10 episodes of going to the bathroom and getting these watery stools, if it is more than 10 times, it is called diarrhea. It's time for concern. Now, I'm talking about this for adults. If it is child, baby, infant, newborn, toddler, and elderly, you bring them to the emergency unit because they're going to dehydrate with 1 or 2 episodes. So that's basically how it is. So if you are having certain conditions, like if you are in certain conditions like pregnant, you need to move right away if you develop some symptoms because it's not affecting you only. You have your child. The fetus is going to be affected as well. So you have to take in consideration a lot of things because you might have developed viral infection as a pregnant female. So you don't know exactly what it is, go to the doctor because once again, if affects the mother, this is going to pass to the fetus as well. So there are certain situations, certain conditions that we need to address this immediately. Okay, let's go back to these antibiotics. Remember, anti means against, biotics means living organisms. And which living organisms are we talking about? Bacteria. Used to treat bacterial infections in animals, plants, humans. Well, let's focus on humans because that's the most important thing. So we have 2 types of bacteria, gram-positive and gram-negative. Now, pay attention to this because we talk about Streptococcus, Staphylococcus. Gram-positive is Staphylococcus. Gram-negative is Streptococcus. So that's basically what it is. So don't worry about anything else. These are the things that you should be familiar with. So gram-positive, gram-negative is when we process and smear of blood in a glass slide, then use different chemicals to highlight the shape, the form of these bacteria, which is on that particular sample of blood. So gram-positive, once again, is going to turn kind of blue. So immediately you see it, oh, wait a minute. This is gram-positive, this is Staphylococcus. It's not going to be as serious as gram-negative. That's going to be turning red. So that's basically what it is. So gram-positive, just because when someone is being diagnosed and they said, oh, your results were positive, that's bad. If they're negative, that's good. Don't mix them up. Because gram-negative bacteria are very bad. Gram-positive bacteria is the normal flora, Staphylococcus. So that's something that you need to understand. We have different medications, different antibiotics for gram-positive and gram-negative. That's why if you don't know what it is, don't take medications that you don't know whether you have a gram-positive or gram-negative bacteria that is affecting your body. Because if you take the wrong medication, it's not going to do the work. If you take a gram-positive and you have a gram-negative, the medication is not going to work, and vice versa. But what you're going to develop is resistance. Next time that you add the medication that you really need for the condition, not going to work. That's what's happening. So these antibiotics or any other medications are very serious See, when I cover my lecture, that's what I want you to know as my students, for you to educate your family members, to educate yourself, so you don't run into the same general um, criteria than, you know, it is an antibiotic, so it works for everything. No, it doesn't. Not only we have gram positive, gram negative, but we have bacteria that survives under the presence of oxygen and with no oxygen. So that's another thing. So how do you know that? Until you get the blood or you get the blood smear. You're not gonna know. So the medical doctors are the only one who knows exactly what medication they're gonna be prescribing to you according to their findings. That's how it works. How can keeping a positive attitude help prevent infection? Once again, if you're stressed out, you know, you're going to depress your immune system. So that's basically what it is. Says right here, patients are no longer contagious after 24 hours of antibiotics. Why must they continue to take medications for several days? Well, you might not be contagious because you kind of inhibit these microorganisms. The first 24, 72 hours, what we do is the medication is already taking control of the microorganism. The microorganism is not multiplying, it's not spreading, but it's not eliminated yet. So if you stop, some of these bacteria survives and you get sick again, to put it that way. So you have to finish the period of time that the antibiotics were given to you. See, we have a problem with patients. That's called non-compliance. Remember, patients are given a amount of medications to be taken for a certain period of time. They do not take it as prescribed. 3 days after they start taking the medication, they feel good. Oh, I don't have the symptoms anymore. So not having the symptoms does not imply that the bacterial infection has been eliminated. No, it means that the medication is working. It means that now these microorganisms are being taken control. So now we need to destroy them. So this is like capturing a criminal. We book them, we take it to the court. Now we are going to give the verdict. Now it's incarcerated. Oh, now we control it. Now we keep it out of society. Before that, no. Until all this is done and solved, doesn't work that way. So microorganisms needs to be treated for the period of time that the medication was given to you. Remember, just because the symptoms subside does not imply that immediately I have to start taking my medication. No, days, 10 days, 20 days, whatever the time, you have to continue then, even though if you don't have signs and symptoms. Because that's a big mistake if you don't do it that way. Classification of antibiotics. So whenever we take antibiotics, remember, all depends on what bacteria you're being affected by. We have broad spectrum. What is broad spectrum? That works for most of these bacterial infections. That's broad, very broad. I can use it for many of these microorganisms. It can eliminate most of them. Narrow, only for particular microorganisms is gonna work. That's basically what it is. Extended. Now, it covers other microorganisms than otherwise it wouldn't apply for broad spectrum or narrow spectrum, particularly those who are the ones survive without oxygen. So that is how it works. So it covers other microorganisms that are very hard to eliminate. So we have some type of extra antibiotics that we can use for this particular bacteria because the other medications, whether it's broad or narrow spectrum, do not work. I mentioned it already. Antibiotics, it is a huge mistake because we think that might be working. What we're doing is creating resistance. Maybe we are depressing our immune system. And later on, this condition is going to come stronger and it's going to send you to the hospital. Now, one of the things that you have to check here is whenever you're going to give medication, particularly antibiotics, you must ask the patient, are you allergic to any medications? This is the gold standard. You must ask. You can't just say, okay, so in your questions for your exam, you are about you're the medical assistant, you're about to give medications. Forget about the medical assistants, do not give medications. Assume that if they ask you, it's because you can do it. But just on the test, literally speaking. So now, what are the things that you're going to be considered before you give medication? Well, there are many things. Remember the 6 rights, but you're not going to look for that. You're going to look for allergy reactions. Mr. and Mrs. Smith, are you allergic to any medications? Are you allergic to this particular medication? Penicillin, sulfa, because that's the medication that you're going to give the patient. So basically, that's what it is. Culture and sensitivity should be performed before starting an antibiotic. I already mentioned the medical doctor has to evaluate you, has to check your blood, your urine, your feces, anything that is going to tell the medical doctor that you have this particular microorganism, so I can give you this particular antibiotic. So you have to do it before and after. Before, because I need to know what microorganism you have. After, because I need to know whether the medication worked and the microorganism was eliminated. But when you take medications upon yourself, you auto-medicate, how are you going to know that? And bacterial infection because you're not using the appropriate medication or you're not taking it as prescribed. So be careful with all that. Effective antibiotics might be harmless to blood, liver, bone marrow, and kidney. Well, effective means that it works for the microorganism. Unfortunately, this medication also can affect these particular structures because remember, they might be, activated by the kidneys, by the liver, but it runs through the blood. So we need to make sure that these antibiotics that we're giving you have a low possibility of toxicity, low levels of toxicity. Now that this antibiotic is effective against this particular microorganism, it's not just any antibiotic. The benefits should outweigh the risks. So you're going to develop some side effects, but side effects are less than the benefits that this medication is going to produce, then we're definitely going to do it. We're going to give you the medication. So that is an effective antibiotic. That's why we shouldn't be taking antibiotics on our own because we don't know if we're taking the right one. Adverse reactions to antibiotics, allergy reactions, remember, hypersensitivity means an allergy reaction. Organ toxicity, we mentioned already, liver, kidney. Superinfection, well, that we're going to make it worse instead of making it better because we are going to eliminate the good flora, the one that protect us. Now we're going to suppress the immune system. And one of the ways of suppressing the immune system is antibiotic overuse. Taking antibiotics for everything, even though if we don't have an allergy, bacterial infection. Remember, patients just want medications, even though if they know, even though if they don't know what they have. You have a bacterial infection, I'm gonna give you an antibiotic. Good. You have a viral infection, I'm not gonna give you antibiotics. Why not? I need medications. If I don't give it to you, you're gonna get it otherwise. So not good. Antibiotic resistance, we talk about this. In general, what it means is that these antibiotics do no longer work for that particular condition, for that particular microorganism. They do not work due to abuse. Remember, over prescribed medications. So you're abusing because you're asking not too much about this medication because you think that still have the infection. So that's basically what it is. Not taking the medication as prescribed, non-compliance, definitely. So here we have some examples of what is considered broad spectrum antibiotics. Remember, broad spectrum means it covers most of the bacterial infections. Penicillin is one of the best, but it's one of the most common medication that causes allergic reactions. Cephalosporins is a family of the penicillins, used also as a broad spectrum. Carbapenems, don't worry about that. Tetracyclines, another one, the medication that we can use if you are allergic to penicillin, we give you tetracycline. Aminoglycosides, that's another antibiotic, but it causes problems with vision, hearing problems, macrolides. So these are just classification. You don't need to know this, just for you to know that these are broad spectrums, meaning it's so commonly widely used because they work for most of the bacterial infections. So usually when you go to the doctor, they give you penicillin or cephalosporins or tetracyclines. The microlysed aminoglycosides will refrain a little bit due to the level of toxicity you can develop. So penicillin, see, this medication always needs to be taken with an empty stomach, lots of fluids, water. Most of the medication needs to be taken with water. Not all the medication needs to be taken on an empty stomach, meaning before meals. Some of the medications you can alternate. See, here it says, do not take these medications, penicillins, with any other drinks that is not water. No fruit juice, no wine, no tea, no coffee, no nothing. So that is basically what it is. So when we do not follow these instructions, you take it with tea, with coffee, with milk. Well, the medication is not going to work. Regardless, whether you take it religiously at the time that the medical doctor ordered you. Every single medication, unless explained, directed by your medical doctor, should be taken with water, plain water. That's cephalosporins. Now, it can be done with, after, before meals. Now, there are different things right there. The instructions will be given to you. But again, there are certain things that you have to avoid. And for any medication, you should not consume alcohol when you are taking this medication. Take it with fluids, water, unless otherwise directed by the doctor. So no worries about this. Contraindications for tetracyclines. Children under 8 years of age, pregnancy or lactating females should not be taken it. People who has renal or liver disease should not be taken it. You're not going to be asked about this. It's just, for you to know. Special considerations, permanent discoloration of the serious teeth. So your teeth, the serious, that's for children, because the serious teeth are the milk T. These are not the adult's T, not the permanent. That's the secondary T. So if a child is being given this medication, the teeth is going to be discolored. So it's going to look like yellowish, orange. So it's kind of scare the parents. No worries. It's just the medication that causes the discoloration. Take on an empty stomach with water. So most of them will be done that way. See, do not take it with dairy products. Can you imagine with milk? Milk neutralizes the medication. It's not going to be good. No calcium, no acid, no antacids, no iron. Medical doctor will explain. The medical doctor knows what medical conditions you have, what medications you're taking, so they're going to make sure that they're going to give you medication that is not going to interact with other medications that you're taking. Aminoglycosides, now these are medications that definitely we need to be very worried about, kidney problems, pregnancy. People who has problems with hearing, remember, vertigo, myasthenia gravis. So this is a condition where you have, paralyzed muscles and so on and so forth. No worries, you're not going to be asked about these medications, special considerations. So once again, one of the things that affects the most is hearing, ototoxicity. So these medications usually we avoid giving it to the patient because it causes more problems than actually fixing something. Macrolides. Now, these are medications that are very common because we can use them if you are allergic to penicillin. Erythromycin, azithromycin, clarithromycin, all the mycins available. So whenever the medical doctor gave you something, if you are allergic to something, they're going to change this medication to make sure that you don't develop a hypersensitivity to it or an allergy reaction. These are the things that we mentioned already. Antiseptics and disinfectants, we talk about this. Remember, antiseptics is used for humans, tissue. Disinfectants are used for inanimate objects, your desks, the floors, the equipment, all those things, but antiseptics is going to be using on the patient's skin, living organisms. What will be those samples? Alcohol, peroxide, iodine, betadine, all these chemicals that we use to pour or to cleanse the skin. Disinfectants are for things that are not living organisms. So that's basically what it is. Very simple. Effectiveness all depends on the temperature of the area. Remember, if the temperature of the solution is cold or the temperature of the solution is kind of warm, it works different. The time that we are going to use these chemicals and we're going to spread the surface and we're going to keep it there also affects its efficacy. That's basically what it is. Anything else, don't worry, because that will be kind of chemistry, but that's how we deal with it. So you need to know the difference between antiseptics and disinfectants. They're going to give you a question over there when they're going to say, okay, you have a blood spill, because that will be covered in phlebotomy, but that's the only time that you talk about disinfectants. You have a blood spill over the counter when we are preparing an sample or collecting an sample of urine or blood. You got an spill, how are you going to clean it? Use a disinfectant. That's basically what it is. What is the most common disinfectant that you're going to use? Bleach. What is the percentage of that bleach? 10%. So that's basically what it is. Antiseptics, remember, is anything that you're going to use in living organisms. You're going to cleanse the skin, an organ, something within the body, you use antiseptics. Basically, that's how it is. See, bleach, this is question for exam. Recommended by OSHA, remember, the Occupational Safety Health Administration that controls, that directs the medical providers or any employer to provide you with all the personal protective equipment, to give you all the information about the hazard materials that you're going to be working you're going to be exposed to it. So that's basically what it is. So every single time that you have a spill, urine, feces, body fluids in general, how you are going to decontaminate, disinfect this area, bleach 10%. That's it. It's not 100%. 100% is not better. No, it is 10%. That's all you need. Anything else, it will become a hazard for you to handle. So 10% is just good. What is the most common antiseptic? Alcohol. What is the percentage? 70%. We will go over that during phlebotomy. But I mentioned this because I have some students that are, this is the last module. So I want them to keep this information, even though you mentioned it before, but, just keep repeating them because you're going to have it. Okay, any question about this particular chapter about microorganisms, particularly bacterial infections and antibiotics and types of antibiotics? That's basically what's important. Remember E. coli, the most common microorganism bacteria that causes urinary tract infection. Very important. Very important. All right, if you don't have questions, let's take a break. And when we come back, we're going to go over viral infections and fungal infections in a very basic way, the same way that we discuss antibiotics. All right. So see you back 7:40. Have any questions, then we can discuss those when you return. All right. See you then. Okay, so we are back from break. We are going,
Yes, thank you.
we are going to continue with um, antiviral and antifungal medications. Remember, just the basics, so you can have an idea of what is a fungal infection, what are the most common fungal infections, antiviral, common antiviral and viral infections, common viral infections, and some of the medications. Even though you don't, then we are going to discuss them anyways. So here there are some um, microorganisms that causes infections. Adenovirus is a one of these microorganisms that causes infections. Again, what's going on with my internet now? Okay, so let's switch internet services of the internet. A organism that causes an infection, a viral infection. Oh, what is going on with this internet problems? Antibodies. Remember, we have certain organisms in our body that protects our body. They're called antibodies and antigens. That's basically what it is. We have the Candida. Candida is a infection. I'm going to talk a little bit about that. We have the cryptococcus infection, cytomegalovirus, cytomegalovirus, which is a viral infection, and epidemiological that has to do with epidemic, something that happens within the population when we have an outbreak of these particular infections, particularly when we have viral infections. Herpes simple zoster and HIV, which is the human insufficiency virus. Again, we heard about many things. We're just going to talk about the basics about these terms. We have immunodeficiency, immunocompetence. So histoplasmosis is a fungal infection. It's just called like that. Immunocompetence now again is someone who is the immune system is in good shape. Immunodeficiency, the immune system on the person is weak. Phagocytosis, this is how these uh, white blood cells works to eliminate organisms by the process of means to eat. Osis, side means cells. Means a abnormal condition of how certain cells, particularly the white blood cells, eats microorganisms to protect us by eating. Retrovirus, it has to do with HIV, which is a virus that, goes back to the time that the virus was produced and was tried to inhibit it. So try to refrain the reproduction of these cells that produces the virus. So that's to contain it, to inhibit them. So that is retrovirus. Varicella, so that is another condition that is produced by viral infection, which is also known as chickenpox. a lot more common. So that's basically how it is. Antifungal infection agents. Remember, we talk about antibiotics. Now we're going to talk about antifungal agents. What is an antifungal? Medication that protects you against fungal infections. So here we have these fungal infections that mostly affects the skin, the mucous membrane. So anything that has to do with the inner parts of the openings inside our body or the skin in general. We talk about these conditions at the beginning, which is histoplasmosis. It's a fungal infection. Candida is a fungal infection, very common. We discussed that in particular. Cryptococcosis, that's a fungal infection. Athlete's foot, fungal infection. Tinea is a type of fungal infection, but we have different classifications. So this is just fungal infection, how they affect certain parts of the body, and the different names of the fungal infections depends on what part of the body is being affected. So special considerations. Anytime that you are applying antifungal medications, you to wear personal protective equipment, particularly gloves. Once again, you wash your hands, put gloves on, apply the medication, then remove those gloves, wash your hands. Remember, if you get in contact with these antifungal agents and then it is on your fingers or other parts of the body, and then you have contact with the mucous membrane, eyes, nose, mouth, any other opening of our body, you're gonna cause spreading these medications where they're not supposed to be applied. So once again, very important, contaminating, understanding not to contaminate these medications. Um, if you apply these antifungal medications in the genitals, you should refrain yourself from having some sexual intercourse during that particular time. So that's basically what it is. Remember, these antifungal agents only works in the area where the patient has the infection, and when he has the infection, this infection can spread around, so you don't want to have contact with the areas that the patient has an infection. So, in other words, keep away a lot of things that you should not be doing or not doing at that particular time. Keep the area clean and dry every single time that you have an infected area. Of course, you have to keep it clean, dry. Remember to prevent the spread of these microorganisms. Remember, if we keep it clean, we talked about that before. We're gonna eliminate the environment for these microorganisms to reproduce and multiply. Contraindications for fungal, antifungal agents or medications. Just like any other medication, remember, whether it's an antibiotic, antifungal, antiparasitic, we have to take in consideration allergy reactions, whether the patient is allergic to the medication or to any of the ingredients. If you are allergic or you are hypersensitive to these particular medication, you shouldn't be using it at all. So antifungal medications, if they get in contact with bone marrow, they can suppress the bone marrow. Now, think about this. The bone marrow is the one that produces red blood cells, white blood cells, and platelets. And if you apply this medication or get in contact with the bone marrow, you're gonna damage the bone marrow. So you're not gonna be producing enough red blood cells, white blood cells, and platelets. That's not good because that is the components of the blood. And if we don't have the components of the blood, each component of the blood has a different function that is vital to the survival of the person. If you are damaging, not good. Impaired renal functions, meaning the kidneys, most of these antifungal medications, we are talking about these antifungal medications that are given intramuscular, intravenously, otherwise, not the topical ones. Some of the topical ones are kind of safer than other means of applying antibiotics, antifungal medications. Remember, this is to treat fungus infection. So whenever you apply these medications, whether it's topically or otherwise by injection, you should refrain from having contact with other people, particularly expose the areas to other people that can have contact with. So that's basically what it is. Now, once again, one of the most common one of the common conditions that a patient can be affected by any medications, whether it's antibiotics, antifungal, antiparasitic, is pregnancy or during the lactation period. So right after delivery, remember the mother start feeding the baby, breastfeeding. So we have to be very careful because if the female receives these medications are going to be passed through the placenta if you are pregnant and through the milk to the baby if you are already lactating. So you have to be very careful with this. Now remember some of the warnings on certain medications are keep this medication away from the reach of children. That's number one. The second one is if you are pregnant this particular trimester or whatever else, you should be very careful, follow the medical doctor orders or guidelines. So you shouldn't be just taking medications or applying antifungal medications without the directions from the medical provider, because that can affect not only the mother, but the fetus if you're pregnant, or the baby if you are lactating there or breastfeeding. That's basically it's telling you. So have to be very careful whenever we encounter these situations. OTC, remember this is over-the-counter medications, particularly we have OTC for almost every medication. Antibiotics are very seldom found as an OTC because they carry a lot of risk of developing resistance to the medication, and because of their side effects or the abuse, because everybody who has whatever type of infection, they might think that it is bacterial and they're going to use antibiotics. So it's rarely used as an over the counter. But antifungal, yeah, because they are a little safer. But once again, you have to follow the recommendations if you're pregnant or lactating, and other patients that might be allergic to the content of these medications. So according to the FDA guidelines, once again, some of these medication, regardless of the medication, is not only for antifungal. It may contain only active ingredients limited to a specific list. So only is used for certain types of fungal infection. Not all the fungal infections are caused by the same microorganism. Not all the bacterial infections are caused by the same microorganism. So we have to treat them differently with the appropriate medication. So that's basically what it is. Every single medication, according to the FDA, contains a label and insert with all the information about the medication. So you have to read it, because one of the side effects, adverse effects, allergy reaction might be caused by the medication. Just because it is over-the-counter medication does not imply that it's 100% safe. They are safer than the other scheduled medications. But still, you have to use these medications carefully. That is basically what it is. So sometimes we don't have all the information about the medications because we don't read labels, we don't read the insert of the medication, so we can put yourselves in trouble. Remember, we have to consider particularly minors, underage children, infants, um, toddlers. We need to be very careful because they can reach this medication and they can intoxicate themselves or whenever we apply them. Because remember, fungal infection like ringworms, very common. Athlete's foot, very common. Diaper rash, very common. So if we use this indiscriminately, not paying attention and following all the recommendations, then we might cause some damage to the child. Remember, some intoxication. So that's basically what it is. Remember, diaper rash, it is a fungal infection. Athlete's foot is, fungal infection. So whenever you develop this rash under your armpit due to the fact that you are sweating too much or you kind of obese in between your legs, your buttocks, and your feet, well, that is a type of fungal infection that you develop. So you have to be very careful how you manipulate, how you apply these antifungal medications. Some of them have more severe side effects, adverse effects, levels of toxicity than others. So you have to be careful. And the route that you use to give them also needs to be considered. But here they're talking about over-the-counter medications for fungal infections. So we need to be very careful when we deal with these medications. Synthetic drugs, remember synthetic drugs are those drugs that are created by the laboratory. They are not extracted from plants, minerals, or biologics. It is made of, it is fabricated synthetically. So you got to be very careful. And sometimes we don't have the proper sources to get these antiviral medications because these are antiviral agents. Remember, this is to treat viruses. So we need to make sure that we got, the compound, the appropriate compound of chemicals that are going to be inhibiting these viral infections. Not every single, remember, viral infections, we don't cure them, we don't kill them, we inhibit them. So that's basically what it is. Some of these common viral infections are herpes simplex. We have herpes simplex 1, herpes simplex 2, and we have herpes zoster. So what is the difference herpes simplex 1, herpes simplex 2? Well, herpes simplex 1 is those mouth sores. That's not a venereal disease. This is not an infectious disease. This can happen to anyone when the immune system kind of goes down because you're stressed out. So then you develop these mouth sores. Now, herpes simplex 2, that is the sexually transmitted infection, which you're going to see a bunch of blisters in your genitals, whether the female genitals, the male genitals, and is very highly contagious. It can pass to one person to the next just having direct contact. Those blisters should not be pop out if you have them. They have to be treated with antiviral medications. It is painful, it burns, and it's very uncomfortable to have this blister in your genitals. Can you imagine? That will be very painful. So again, it's a very, very highly contagious viral infection. So that's basically what it is. This herpes virus, you're gonna have it forever if you develop them. Any viral infection. So it's very easy to detect in males more than in females. Because remember, the females' anatomical structures are kind of hidden. So the blisters might be hidden underneath, the labia minora or majora, maybe by the vulva, maybe inside the vagina. Versus males' blisters are going to be on the surface of the head of penis to penis, which is more visible. The male is going to notice a lot easier that they have those blisters versus the female. But the female is going to notice that they have this burning sensation, even though if they are not peeing. And when they pee, they're going to feel it more. Why? Because this acidity from the urine is going to kind of get in contact with the blisters and they're going to make it burn more. So a physical examination of the genitals, we're going to encounter those. And remember, these are not the same blisters that appear on your mouth sores, things like that. That's a different one. This is herpes simplex 1. And 2 is the venereal of uh, infectious sexually transmitted disease. Very commonly transmitted. Remember, you have these blisters, they disappear, then you get them back again. So it is going to be intermittent, on and off, that you're going to develop these blisters, and they're very painful once again. Influenza, which is the flu. Remember, that's when you have all these symptoms: runny nose, itching eyes, burning eyes, sore throat, a little fever, malaise, meaning you feel kind of tired. So that is influenza. Remember, influenza, we just abbreviate it by saying flu. So most of the time, we just call it the flu. Herpes zoster, on the other hand, herpes zoster is a family of the herpes, but this is the one related to chickenpox or varicella. Usually, we don't call it herpes zoster. Well, in the medical, we do, but the regular population call it shingles. So this is where you develop these ulcers, these kind of big, large blisters in certain parts of your body. They are super very painful. Patient comes complaining about back pain if you develop them in the back. If you develop them in the face, they're gonna look like you burn the skin with a cigarette butt. So they look really bad and they are very painful. And it is highly contagious. Remember, it's the liquids that it is within these blisters that A contains the virus. So if you have any direct contact with the person, you're gonna get it. You're definitely gonna get it. So you have to be very careful when someone is having these blisters and getting in contact with. So that's basically what it is. Now, herpes zoster happens to adults and immunocompromised patients. Why? Because herpes zoster, let me rewind. This is the family of the herpes, right? So if when you were a child, you develop varicella, which is chickenpox. If you develop varicella when you were a child or a youngster, now you will have the virus in your nervous system, in your spinal cord. It will be dormant, meaning kind of inactive. But whenever your immune system gets down, whether to other immunocompromised conditions or infections, this virus is gonna be activated and you're gonna develop those blisters, very painful ones. So again, most of the time, people develop these after certain age. So 50s, 60s, 70s, 80s, because the immune system has been compromised. But if you have other medical conditions like HIV, then you're gonna develop these herpes zoster very early in your age if you have HIV early in your early years. So that's basically what it is. Very, very, very common condition, particularly for those who developed chickenpox when they were a child. Remember, this is the same virus that causes chickenpox, but now it's going to be reactivated in the adulthood when your immune system is compromised. Remember that I told you that these viral agents, microorganisms, these viruses, they do not die. They stay in your body. We suppress them when we give you medications. But then they go to sleep, so to speak. They're going to stay dormant. So whenever your body becomes very weak, your immune system, then immediately they see the opportunity and they come out because your immune system is not suppressing them. So that's basically what it is. So one of the questions that you might have in your exam is herpes zoster is also known as shingles or vice versa. Shingles are also known as herpes zoster. Another question. Who is more prone to develop shingles or herpes zoster? Someone who have developed chickenpox. Remember, if you have chickenpox when you were a child, you are prone to develop herpes zoster later on. So that's how it works. So we have to be very careful because sometimes people mix the pain with back pain. So you have to kind of disrupt the patient, ask the patient to remove their clothes, and physically evaluate this. And when you see these blisters, large one, very ugly one, and then immediately you know that this is shingles or herpes zoster. Very common once again, and very contagious. Got to be careful. Drugs for herpes simplex or herpes zoster, acyclovir. Cyclovir is one of the most common topical creams, ointments out there, and they really work. I have several patients that I prescribe this medication, and it does work. It works so much that, remember, there are sexually transmitted this virus, which is the herpes simplex 2, but it works also for the common colds, which is the mouth sores that you develop. You can apply a cyclovir or any of the family for that matter. From cyclovir or benzyclovir, well, there are many ones. If ends in cyclovir, that is a family of these medications that are used to treat viral infections, particularly the herpes. So it is good. It works. Not much for herpes zoster, but simplest and sexually transmitted herpes. These conditions are very common, believe me. So these medications are common as well. You can get over-the-counter medications, a cyclovir as an ointment. So, but the first thing that you have to do is being evaluated by the doctor to make sure that you're using the appropriate medication for the appropriate condition. Other than that, you might be applying a medication that is not suitable for that particular condition. So cyclovir, very common. Sometimes they throw a cyclovir over there. What is the cyclovir drug used for? To treat herpes. So that's basically what it is. Just herpes in general. Remember, herpes zoster, herpes simplex 1, herpes simplex 2. That's all herpes because it's the family of the herpes. Because the picture presentation during the signs of this condition are blisters. So then we know what medication to give. So here it is once again. These drugs, meaning the drugs used for treatment of herpes, whether it's simplex or zoster, do not cure herpes. Remember, none of these antiviral medications cure viruses. No, there is no such a thing. Otherwise, can you imagine? We have already got the cure for HIV. HIV is a viral infection. We don't have a cure because it's a viral infection. Viral infections do not have a cure. Cure means that we destroy the microorganism. We remove it from the body, as we do with fungal infection, parasites, and bacterial infections. Herpes is a lot, virals are a lot different. Remember, viral infections do not have a cure. So whenever you have a question, it says, which of the following microorganisms do not have a cure? Viral infection. That's it, period. Any condition that is virus, hepatitis B, because they are virals. Herpes, any of the herpes. So anytime that you hear about viral infection, they do not have a cure. Now, the amount of the medication applied depends of, how extended the condition is. So all depends of what is it that the patient have, what is the extension of the disease or the infection for that matter, and the type of herpes that is being treated. So that's basically what it is. So the medical doctors can explain. You have to use these once, 2 times, 3 times per day, and so on and so forth. So you have to, apply over the affected area. Because remember, these are blisters. These are superficial. But there are different types of herpes. So the amount of medication that is applied to then varies depending of the type of herpes that you develop. So take home point right here, herpes do not have a cure, remember. Always remember that because that's question for exam. Once again, every single time that you're handling medications, you always wear your personal protective equipment. I got, the habit, because remember, these medications are going to be, your hands are going to be exposed to it. So sometimes it's like unconsciously, You just place your fingers, you scratch, you touch, you rub, you do something. It is unconsciously. If something bothers my nose, unconsciously, you just put a finger. I pick my nose. I rub my eyes. I scratch something. And if you have, residuals of these medications, well, you're going to place these medications where they do not belong, where there is no infection. And this medication shouldn't be on that particular mucous membrane. So you're going to develop some side effects or adverse reactions. Not good, huh? So that's basically what it is. So we have to be very careful, particularly with the mucous membrane of the eye, because we always rub in our eyes. For any reason, we just touch or we just pick our nose. So here we have influenza. So what is influenza? Once again, this is the flu. It's a viral infection. So it is a very, very common condition. At least every single person in their lifetime develop one episode of influenza, which is runny nose, itching eyes, kind of scratchy throat, sore throat, body ache, like being a little weak, like, you know, you just want to sleep or something like that, maybe mild fever. So those are symptoms of having influenza. Once again, needs to be evaluated by the medical doctor because some of the symptoms might be common for other more serious infections. So there are certain medications that are used for that. No worries. We don't even need to mention them. So you just follow the recommendations of your medical doctor. Now, most of the time we give medications to the patient when they have these viral infections, not directly to treat the viral infection, but the symptoms. So we might be giving you a bunch of medications. I mean, if you have pain, swelling, we're going to give you an anti-inflammatory medication, pain medication, an antipyretic or fever medication. So remember, the patient goes to our offices because they have these signs and symptoms and they feel it is very bothersome for them. So we start by trying to relieve those symptoms. So that's basically what it is. Sometimes we don't even have the medication or we don't even have the diagnosis. It looks like it's this condition, but has different um, symptomatology or signs and symptoms. So once again, that's the reason why, we always recommend people not to auto-medicate themselves. Because it sounds like I have this, I have this, I have this, but then these symptoms are very common to other conditions. And they share symptoms with, fungal infection, bacterial infection, parasitic infection, viral infection. But the first thing that it is occur is to take an antibiotic when actually might not be. So we need to be evaluated by a professional always before we, you know, auto-medicate ourselves. So once again, it says right here, antiviral drugs do not cure influenza. Non-antiviral, none cure any viral infection. So don't forget that because that is very important for you for the exam. Remember, viral antiviral medications do not kill the viruses, do not eliminate. In other words, there is no cure. We have medications to depress the virus, meaning we kind of inhibit them so they do not multiply and they don't cause us more damage. They don't cause us more signs and symptoms. That is there. That's it. The microorganism is there. It's not gonna leave our body. It can become active at any time, meaning it can wake up at any time where our immune system becomes compromised. So those are the things that we definitely need to take in consideration. This is not about knowing what is a virus, how it works, what is the composition, what is the physical appearance. No, we don't care about those. It's just to get familiar with things that are very common. People develop flu all the time because we just were exposed to someone who had the virus. So because it's a so common infection, we need to understand that these viruses do not have a cure. And that's what we keep on getting this flu over and over and over. So you said, oh my God, I thought this condition was treated. And they come back again and again. You go in remission, go in a period of time that you don't have the symptoms, then flare ups again. Because the virus is there, it's still alive. It's just sometimes we inhibit them, we suppress them. Because our immune system do so, because we have medications to do that. But then the effect of the medication passes, your immune system becomes weak. Here we go again. These virus show up again and start multiplying and start causing the symptoms again. HIV. So we heard about HIV a lot. Remember, HIV is not the same as AIDS. HIV is the virus that have entered the patient's body, the patient's bloodstream. AIDS is where, the last stage of HIV, when all the defenses in our body has been compromised due to the viral infection, meaning the viral infection destroy all the defenses. And we become so weak because we don't have the defenses anymore. The immune system has been completely shut down due to the virus, because that's what the virus does. HIV virus, that's what it does. Destroy the immune system. And when you destroy the immune system, we don't have defenses. Now we collapse. Now we call it AIDS. So here in this case, we're going to talk about HIV in children. Why? Because it's not that children got HIV through, other means, but that it was passed through the female's placenta, because the female had HIV or have sexual intercourse with someone who has HIV during pregnancy. So this virus is going to move to the bloodstream and pass it to the placenta, to the fetus. So the fetus is going to be born with HIV. The female has it, the child develops. So that's basically what it is. Now, it's not just during pregnancy, but during lactation or breastfeeding. So, female who is breastfeeding their child and they discover that they are HIV positive, should not breastfeed the child anymore because this virus can pass through the breast milk to the child. So that's basically what it is. It is every single child that is born from a HIV female is going to be 100% HIV positive? No. There are 25% chances that an infected HIV female will deliver a baby that it is HIV. So that's basically what it is. Now, it is still in the process of a vaccine for HIV. So as soon as the baby is born from a female that it is HIV positive, we're going to run a blood test. But that's not going to be a definite. Patient can be HIV just because the baby is being fed up with the female's blood and still have the female's blood within their circulation. So we have to do different tests after the baby is born. And after a certain period of time, if HIV is positive, then we can confirm that the patient is HIV, the newborn. Other than that, it's not. There are some females that have babies that they are HIV, but the baby is not HIV. So once again, it is not a definite that a HIV infected pregnant female is going to deliver a baby 100% that it's going to be HIV. No, there are 25% chances. It's a lot, but still there are 75% chances that the child might be free of HIV. So that's basically what it is. So these females that are high risk of, passing HIV to the child or to the fetus, whether during the pregnancy or lactation, then, we are keeping an eye on this patient. Patient is going to be monitored and making sure that, the child is protected as much as possible. So that's basically what it is. Who are some children who could be at risk for HIV infection? Well, those who are born from a female that is HIV positive. Definitely. Well, they will be at the risk. It's not that it is 100% that they will be at risk. Anyone else? Who else? Maybe a child who was born with a medical condition that needs transfusion, blood transfusion to be infused to them, and this blood was not um, analyzed correctly, and the virus was there, and it can be passed through. But these are very hard because nowadays blood banks actually, analyze this blood not once, but twice or three times before this blood is available to be transfused to someone else. But during pregnancy and lactation, remember, someone is HIV positive, that's when you have the risk for HIV infection. Or transfusion, once again. Mother to child transmission, once again, HIV. So antiretroviral drugs help prevent HIV. Remember, these are the medications that are used to inhibit the multiplication of the HIV virus. So it kind of suppresses the HIV virus. It doesn't kill it, it doesn't eliminate it, but it suppresses it, inhibits it. So there are more chances that the baby or the mother is not going to pass this virus to the newborn. So that's basically what it is. So other times that a child can be exposed, because remember, during um, normal vaginal delivery, there is no exposed to blood from the mother versus if the child have a C-section. So now normal vaginal delivery can put the child at more risk of developing HIV during childbirth. So mothers that are HIV positive and are pregnant during um, childbirth, mostly they are, um, recommended that they get C-section, because then the baby is not going to be exposed to the female's blood during, the vaginal delivery. So C-section helps to reduce the risk. And who doesn't want to protect their child? So females usually, you know, go for it. They accept the C-section. So now the babies are going to be treated because we have anti um, HIV medication, so to speak. It's called antiretroviral drugs. Child is going to be treated. The female is going to be treated during and after the child is being born, because we are going to make sure that this virus that the child inherited from the mother is going to be suppressed. So basically, that's what it is. Forget about the bond that the mother creates with the child during breastfeeding. We have to replace that with a bottle because, once again, during lactation breastfeeding, this virus still can be passed to the child. Can you imagine that the virus was not passed through the placenta? The baby was born without the free HIV, but now you lactate the child and you're going to pass the HIV. So that's not good. So patients are educated about the risk of passing, HIV to a child. So they offer the C-section and the antiretroviral drug administration for the child and for the mother. Any questions about HIV during a pregnancy or lactancy? Because it's important. Not that you will be asked, but whenever you've been asked about any condition, particularly viral infections, they are going to pass through the placenta. They're going to be absorbed through the placenta. And if that happens, these viruses are going to affect the fetus that is developing inside. That's why these viruses are so difficult to eliminate, because they have a very strong wall that doesn't allow medications to get inside. But this has to do with the DNA and all the stuff, the genetic material. So it's a very, very complex topic, but it's just for you to have an idea. So what happened to HIV and the older adults? You might think, oh, well, elderly patients, or someone who is above 50 years old. Oh no, these people are very educated. They have, they already heard about a lot about these viruses, particularly HIV. So they're not gonna get this. Well, guess what? It's not like that. The older you get, young people are a little careless, but there are more people at all age because they get involved with other old people. So they think that because they are old, they were no, they protect themselves in the past, that they don't have any medical conditions, that they are not promiscuous, but that's not true. So that's basically what it is. So elderly population have lots of medical conditions like syphilis, AIDS, gonorrhea, chlamydia, you name it. It happens a lot. And they think that, that the person that they're gonna have sexual relations, they are clean and their nothing is gonna happen because they are old. Back in the days, they didn't have that. This person just came from a relationship. It was, um, you know, not promiscuous. It was only one partner. No. So we cannot assume things because it happens more than you think. As we grow older, the immune system weakens. So that's another risk for it. So that's basically what it is. So the fact that you are older does not imply that the virus is not going to invade your body. You have to take the same precautions as a younger person. See, said right there, 10% of AIDS patients are older than 50 years old, and 4% are older than 65. So that's a lot. Considering all the studies, all the research, all the information that is being given out there for HIV, precautions, people still develop condition, not as much as before, because now we have these very strong medications that kind of suppresses the virus, so you don't reach the full bloom of AIDS. But still, there are a lot of people who are HIV positive. Even though if you've been controlled, your HIV has been suppressed, you're still a carrier. It's a virus. The virus is still alive. And if you have any interactions or exposed to body fluids, chances of developing HIV are high. So you have to be very careful. How would you teach an older adult about HIV prevention? Well, it's just to protect themselves and to tell them that as we grow older, our immune system goes down. And our brain is not thinking the same. So you think that because you're older and because you're engaging with an older person, oh no, nothing's gonna happen. Only happens to these promiscuous people, to this youngster. No, it can happen to anyone. Remember that the virus has been there and the patient might be a carrier for a long time since they were young. Now they're still adults or elderly. The virus is not going anywhere. So just protect yourself. Use protection, prophylaxis. That would be the best recommendation to prevent it. There's no vaccines. Or bottom line, abstinence. Don't do anything at all, which, is going to be a little difficult to follow. Just protect yourself. That's all you have to do. That's how it works. Immunizations, there are a couple of questions right here for the exams about immunizations. There are active and passive immunization. So pay attention to these two terms because active, passive, how is an active immunization acquired? Administration of vaccines. That's it. So whenever you hear about active immunization, is because you have been given the toxoid, the actual virus, the viral infection is being applied to you through a vaccine. So we're going to create those antibodies inside your blood, antibodies from this particular um, condition. So whenever you are exposed to that condition, then your body is going to recognize it and it's going to protect you because you have the soldiers that recognizes that. This is like entering into your body, like some cameras right there, some magnets. So as soon as the virus enter your body, you are being recognized, you are being identified as this particular virus. So that's what immunizations are so important. So the question will be how active immunization works. Well, you are receiving a vaccine. So vaccines are considered active immunization because it is being given to you. It is being manufactured by someone, somewhere. Now, I'm going to give it to you so you can be protected. Now, what is passive immunization? Now, these are immunoglobulins that are being given to you. Now, we are giving a different type of immunoglobulins that are going to be injected to you. So we're creating that immunity as well. So once again, we are creating those antibodies in your body. So whenever the medication, the disease shows up, they are going to be recognized. Now, this passive can be in a way of breastfeeding. So that's basically you give some antibodies to the child. You reinforce the immune system of the child. Remember, active through vaccines, passive through other means like, breastfeeding. Because remember, the parents are going to give us some antibodies that are going to be helping the child to mature, to strengthen their immune system. That is basically what it is. So active vaccines, passives given through the mother. Breastfeeding is one of the most common. So that's how it works. So there are many types of immunizing agents or vaccines. So vaccines, toxoids, immunoglobulins, specific immunoglobulin, antitoxin. We're not going to worry about this much. It's just different things. Just remember vaccines and immunoglobulins. These are very important. But just vaccines, because that is an inactive way or active way of giving immunize or preparing the person to combat these microorganisms, particularly viral. Remember, vaccines are only for viral infections. We don't need vaccines for bacteria. Why? Because vaccines are to prevent the condition that doesn't have a cure. We don't have vaccines for bacterial, for fungal, no, because they have a cure. We just give medications and we eliminate those microorganisms. So we don't need them. That's basically what it is. What might be some reasons that a parent would not get their child vaccinated? You know that. Fake news. The misunderstanding of how the medication works because people spreads false narrative saying that if you get the vaccines to this child, the patient is going to develop this particular condition. Oh, your child is going to be autistic, your child is going to be mentally retarded, and so on and so forth. Or they actually want to kill your child, which is false. And that answers the next question. What are the possible repercussions of failure to vaccinate children? Well, the child is going to develop a condition that probably is going to be fatal or is going to leave a sequela, meaning the child is going to suffer physically, mentally. It's going to have injuries that is going to stay with them for the rest of their lives. So that is basically what it is. So vaccines are good, prevents serious medical conditions. They are there for a reason, so that you get it. Unless they are hypersensitive to the content of the medication, that's a different issue because you can develop an allergic reaction. But other than that, there is a contraindication to it. So here answers what I just said. Check for allergy to any components of the vaccine. Just naming the vaccine does not mean anything. Is what is the vaccine made of? What are the ingredients, so to speak? Meaning the components. If you are allergic to any of those components, medication should not be given. So there are certain medications that depends on the condition that you may have, should not be given to the patient. So that's basically what it is. So do not worry about anything else. It's just lectures. I don't want to feed you out with all this information that you're going to forget. It's just names and types of vaccines, depends what is the source of the medication. But just think allergies is the major contraindication that have for any medication administration. That's what we ask about allergies prior to administer medications. Simple. Vaccines should be deferred during severe febrile illness. Every single child that has a condition that is an infection, infections are the only ones that causes the body temperature to increase, which is called fever. If you have fever, many things are not done. Surgical procedures are not done. Certain medications are not given to the patient when they are febrile. Remember, febrile means fever. Oh, this is good. So keep it in mind because this is very important. Febrile means that the patient has fever. Afebrile, so you have an A before, means no fever. So pay attention to these terms when you taking exams. A patient is afebrile. That means what? All patient doesn't have fever, no high temperature. What about febrile? Patient has fever. So there are certain medications or vaccines that should not be given to certain people who have high temperature levels or if they are pregnant. So that's basically what it is. So studies have been done, research has been done using, pregnant, animals, not humans. And then they have, found out and, the fetus of the animal didn't suffer any consequences during the administration of these vaccines. Remember, these vaccines are, you know, use they use trials. They have, like any other medication, because these are medications. They go through all this process of, you know, research to see if it works, if it doesn't work, what are the side effects, what are the risks, what are the benefits, before the FDA approves them to be used in humans. So that's basically what it is. So remember, febrile means fever, afebrile, no fever. A means no without, febrile, fever, without fever. So if your child is sick, something we're gonna give them antipyretic medication. That's a different issue. We're not talking about that. We're not talking about medications to relieve fever. We're talking about vaccines. If you have fever, we don't give you vaccine. After giving the vaccine, as the child or the person is gonna develop mild fever, yes, that's one of the side effects. That's not what we're talking about. We're talking about the child or the person being with fever prior to giving the medication. The vaccine should not be given. That is basically what we're talking about. This is another question for national exam. Hepatitis B vaccine. So these are recommendations. I have mentioned this in prior chapters. We are going to continue talking about hepatitis B. Why? Because it is one of these vaccines that is required for every employee. Your employer, particularly hospitals, they're gonna require that you have hepatitis B vaccine prior to job, during the job offer. So if you don't have your vaccination card, then you have to go to your medical doctor and get, blood tests for hepatitis panel. They're gonna do a test and they're gonna find out whether you have the vaccine or not. If you don't have records of your vaccines. Last resort, the medical doctor might offer you to get the hepatitis B vaccine. Now, this hepatitis B vaccine is given in 3 dosages, 3 times, once today, another one 2 months later, and another one 3 months after the first one, or 2 months after the first one. So you have to have 3 different shots to be immunized. If you get the first one and you miss the second one, you're not immunized. Get the first one, the second one, you didn't get the third one, you're not immunized. So you're at risk of contracting hepatitis B. And remember, you can get it through needle stick. You're going to be working with patients that might have hepatitis B. And if you poke, you get in contact, you get exposed to somebody else's blood, you're going to develop that. Now, of course, you can get hepatitis B through sexual intercourse. But we do not relate this in the case of working, because you're going to be working. You're not getting involved in this type of practices. Or you use somebody else's syringe use syringe for someone who's using drugs and you give yourself drugs with the same syringe is contaminated, not only with Hep B, but hepatitis B as well. So anybody who is at risk of developing hepatitis B, um, it is recommended that have the vaccine. See, the first vaccine that the newborn receives 1 day, 2 days after birth is hepatitis B. That's the first one. Why? Because it's very important that we are vaccinated for that. Because hepatitis B is very easily transmitted. So we're going to protect ourselves. So anyone who is at higher risk, and we in the medical are at higher risk because we're going to be exposed to blood. So that's basically what it is. So blood transfusion, anyone who's drawing blood, anyone who's using needles, sharps, and works with the patient. So that's basically what it is. We're not gonna go over, the military personnel because it's increased risk, because they are kind of alone, they don't have a partner. Well, they're gonna be engaging in promiscuous, activities. Same with prisoners and other stuff. No, it's just that anyone who is a high risk of developing hepatitis B should get the vaccine because it's gonna protect you. Period. You're not gonna develop hepatitis B because you already have the antibodies within your blood. Now, for the purpose of the class and the exam, is one of the vaccines that you will be required to have for job consideration. And this medication, your employer can offer it to you free of charge. And you have to have 3 shots, remember, in different times. One the first day, the other one month later, the one 2 months after the second one. And you have to have them exactly at the time that it is needed, the second booster and the third one. If you don't, you have to start all over again with the first shot and the second and the third at the same time that is being scheduled. If you fail, if you refuse to get the vaccine, and the medical provider or human resources, whoever is gonna hire you, they want you, they need you because they cannot force you to do something, but they actually want to give you the job. Then you have to sign a waiver. A waiver means that you are not making responsible your employer if you get contaminated with hepatitis B or HIV, whatever the case may be, during your job operations. So if you happen to have a needle stick or any other type of injuries that involves blood and the patient has hepatitis B and you develop hepatitis B, your job is not going to be responsible for it. That's it, period. So that's how it works. And those are the questions for exam with hepatitis B, remember. It's very common. It's a lot easier to get hepatitis B through a needle stick or any other type of injury with blood versus to get HIV. Hepatitis B and HIV are those conditions that you develop through bloodborne contamination, meaning through the blood. So that's basically what it is. Recommendations for hepatitis B vaccine. Many states are now requiring hepatitis B vaccine for school children. That's been going on for a long time. They require for employees, health care employees. Prior to giving a vaccine to a minor, you must obtain written consent from the parents or guardians. Well, remember, vaccines are a little controversial. So the child cannot give consent because it's a minor. So we always going to get consent from the parents, just in case your child develop a condition that is not due to the vaccine, but the patient, the parents, the guardian, whoever it is, you know, in charge of the child can sue the hospital for this reason. So we're gonna consent them. You agree or you disagree. If you agree, we do it. If you not agree, we don't do it. You put the child at risk. That's your problem. So that's basically what it is. So take home points from this chapter. Remember, hepatitis B. Every healthcare employee, it is required to have hepatitis B before starts job. If you don't have it, your employer is going to offer to you free charge. There are 3 shots to it. Remember, you have to meet all of them. Otherwise, you're going to be exposed at risk of getting hepatitis B. There is no vaccines for HIV, so you will not be offered HIV vaccine. Do the medical doctor is going to order or ask you if you are HIV positive? No, that's a violation of privacy. No one should ask you if you are HIV positive or not to give you employment. Nobody should go and draw blood from you without your permission, without your consent for HIV either. So again, there are certain, protocols that needs to be followed. You don't need to disclose whether you are HIV, hepatitis B. You don't need to disclose any of these to your medical doctor or to the medical, I'm sorry, to your employer. So for employment purposes, things are different. If it is with your medical provider, yes, you should tell everything that you have because you have to be honest. So we know exactly how to treat you and how to protect other people from, you know, the spreading of the virus or any other medical condition for that matter. So that's basically what it is. Any questions about viral or antifungal? So antifungal medications, one of the things that they might ask is about candidiasis. Because candidiasis, they're just gonna ask you, what is candidiasis? Oh, it's a fungal infection. That's it. Nothing else will be candida. See? So candidiasis is a fungal infection. Females develop this very often. This is called yeast infection. That's the same one. So it is a fungal infection. You have to use an antifungal medication. And once again, hepatitis B. Herpes, remember? So very simple questions about this. So you have to be familiar. Any questions? Because we are done with this chapter. We are done with the module. So if you have more questions, I'm going again to let you know that tomorrow we were supposed to meet at the school. It starts off phlebotomy, but it's not gonna happen because I have some issues right here at the airport, so my flight was canceled. I will be traveling hopefully on Saturday. It was rescheduled for Saturday. So then I can meet you guys on Monday, the 10th of February at Manhattan campus. I send you an email. Please read it so you're familiar with. Do not go to Manhattan tomorrow. I won't be there. So we're gonna do the first couple of chapters. They're very short chapters. We're gonna do it online about infection control and OSHA, which are chapters that we have discussed previously. But for those who have not covered this yet, well, I'm gonna use it. It's gonna be new information for them, but it's gonna be a reinforcing information for the others that have taken this. It will be online. And then after Monday, we are going to be in person. There are two modules that are going to be in person, back to back, phlebotomy, and after phlebotomy is going to be electrocardiography, which is EKG. So from now to sometime March the 24th, we are going to be in person. So from the 10th of February to the 24th March, we are going to be in person. There are two modules back to back that are going to be in person. After that, whoever goes to internship is going to go to internship. Anyone else will continue. So we're going to move on to medical terminology, then anatomy and physiology, and office procedures, and so on and so forth. So once again, whenever you have a question, you can email me and I can reinforce that information. Call the director at the school. They have all this information and notify them. These are not changes that are going to be affecting the module at all. It's just the first class that we're going to be having it online due to the fact that I cannot make it tomorrow. I was traveling today, but it didn't happen. So that's basically what it is. Any questions before we say goodbye for tonight? I will be sending you the material for phlebotomy tomorrow. And that is it. We are moving on with these chapters, with these different modules. Time is running. And next thing you know, you're going to be done with this program. Time goes fast. All right. You have no questions. Thank you so much for attending the class. I will be seeing you tomorrow. First meeting online of phlebotomy, but after that, on Monday, the 10th of February, we're going to start meeting at the school. Remember, it's going to be Manhattan campus. I hope you guys have the address over there. Other than that, I will be sending you an email with the address so you know exactly where it is. Or you can contact the director of the school, but I have no problem in sending you that information. Tomorrow, alongside with the chapters for phlebotomy, I'm gonna send you the address. So so you do not encounter any issues reaching the school. Remember, the class is gonna start at the same time as we do online, 5 to 9, and the dates are gonna be Monday to Thursday, at least as long as I'm the teacher. If somebody else is taking over, then you have to adjust to their schedule. Time is going to be the same, but what I'm talking about is Friday might be involved because I cannot do Fridays. I have a lot of stuff to do on Friday. So that's the reason why. Okay. All right. Good night then. Stay warm. We meet back again tomorrow here online. Okay. Good
Hi,
night.
Professor. Professor, I have a question.
Good night.
Surely.
I want to know, are there any information of phlebotomy?
I'm going to be sending tomorrow the PDF formats for the lectures of phlebotomy, just as I have done with the other chapters. Yeah, you will be receiving some material, some lectures, so you can follow along and you can keep it as a reference. Yes,
Oh, thank you.
you're welcome. Anyone else? Okay, then. So good night once again. See you tomorrow, guys. Thank
Good
you.
night. See you tomorrow.
Good
Thank
night.
you.
Bye now.